SAMS Voices, coming to you again from another episode with another hero, another kind of a big achiever who represents SAMS organization and foundation. These episodes come to you first Saturday of the month to highlight and some big achievers within SAMS Foundation, as well as the physicians who has done phenomenal work in the field, especially in our country back in Syria. With me, I'm really privileged to be with Dr. Aref Rifai, who is ophthalmologist and retina specialist in Florida, but he has been one of the first responders to as a SAMS member, as well as of the foundation and society, as well as the treasurer for the foundation. He has been done multiple missions to Syria since the beginning of the crisis, during the crisis, and also has his own vision and mission and plans going forward. Dr. Rifai, thank you so much for being with us. I'm really privileged to meet with you and speak to you about what you have done.
Thank you very much, Shadi. Thank you very much.
Yeah, let's start over by being a busy, very busy, involved in medical school, teaching, ophthalmologist, which is you have a very tight schedule. What was and when was the first time kind of you responded to a mission that SAMS sponsored at the beginning of the crisis?
Thank you very much for everyone that is watching. I'm a retina specialist in private practice, been in private practice for 29 years. I also do hold the position as an assistant professor at Florida State University, University of South Alabama. I do take medical students on electives. But the beginning of the Syrian revolution in 2013, there has been many bombing campaigns that was inflicted on civilians in all around Syria. I started to get involved in 2013, where I went on 4 missions inside Syria, where we did surgery to civilians that have had injuries. As a retina specialist, mostly it was surgery to remove shrapnels from inside their eyes. There were hospitals that were on the border in Rif Idlib, also in close to Azaz, so directly north of Aleppo. So my trips would go in for about a week to a hospital that did have equipment, and we would go see patients, do surgery. That was my initial involvement in 2013. Towards the end of 2013, it became very dangerous for US-based physicians to go over there due to the spread of ISIS to that territory and increased campaigns of kidnapping of foreigners. So I stopped going over there. I basically took a hiatus from being involved with the medical missions or going over there, but my involvement with SAMS continue in supporting, SAMS, attending the annual galas and attending the conferences. But then my, medical mission activities started again as my cousin, Dr. Basil Atassi, one of the young heroes and leaders of SAMS. Almost everyone knows who my cousin is. Asked me actually when I was on a family retreat with everyone that he needed me to start to go to Jordan because the medical missions over there started and they needed a retina specialist to complement the services of ophthalmology, where we were starting cataract surgery and pediatric ophthalmology. And he said, we really need a retina specialist. So I started to go back again on medical missions to Jordan every 6 months.
Now, you are involved in SAMS in multiple missions in the past and now. Some of the audience will be interested, let's say, how we can help now and what are one of the initiatives that SAMS has that they can be part of going forward.
Well, if we are looking at post-liberation, at the present time, the burden that has been thrown on SAMS leadership is huge. We have been conducting medical missions in northwest Syria since, I think, probably on and off, but it increased significantly after the earthquake. February 2023, the Turkish government allowed all of the NGOs and organizations to be able to go inside. SAMS went in and started to have monthly medical missions to northwest Syria. There are only few unique, physicians that volunteered. Still, it was an area under the control of the HTS, the Salvation Government, and it was considered for some people that have not done medical missions to be a little bit dangerous. But having access over there, going over there, had need assessment initially to that area. And then we established several programs of robust medical missions. We do have cardiologists that went to Idlib. We did have cardiovascular thoracic surgeons that went over there. Ophthalmologists went over there. Urologists, GYN that performed, laparoscopic surgery. So the field opened up for us after the earthquake in 2023. And then all of a sudden, alhamdulillah, Allah blessed us while in our lifetime that the liberation just happened last month. And now, instead of having just Northwest Syria, where SAMS was conducting medical missions, now the field has opened up to all of Syria. So the SAMS leadership has been kind of like myself. I did go to Syria about 3 weeks ago. So immediately 3 weeks after the liberation, I did go. The foundation president have been, several of the leadership have been there, mostly need assessment. We went into major cities, Damascus, Aleppo, Homs. SAM's team has been on the ground from the beginning and actually was accompanying probably some of the forces that were liberating towns. They would immediately go and visit hospitals, public hospitals. And we are right now in the stage of making a really need assessment. We are in close contact with the Ministry of Health. Dr. Maher Shara has met with several of SAM's leadership, and basically we are in direct communication, looking and seeing what can we do to help, whether it's education part, whether it is conferences, whether it is training, whether it is actually medical missions, whether it is going to be strengthening the public healthcare system. So there are so many things that SAMS will be able to do. We will be having a retreat this coming weekend, and we'll be having a national conference in Orlando in February. There will be a lot of programs. There will be a lot of initiatives that SAM's leadership will announce in between educational, in between medical missions. Certain dates will be set up, and the members will have a chance of meeting the leadership and getting to know what programs. Because right now is the time for everyone to pitch in. If you are able to go on a mission, if you are able to be in a committee that will provide education, if you are someone that will be able in your local, medical facility, seek to get some supplies, consumables, some equipment that your hospital will donate. There are so many avenues and so many things that our members can do.
You touched on something that inclusive and SAMS has been inclusive in their opinion. And one of them, the upcoming retreat that's going to happen in January. And I know by the time we broadcast this episode, it's going to be already first weekend in February. But just give if possible, what is the retreat is all about, and what is the purpose of it, and who's invited for this retreat?
So we picked about 50 of our leaders across the nations. Most of them are probably your generation, Shadi. I'm probably one of the old timers. I'm not gonna say old guards, but the future of SAMS is going to be in the hands of the younger physicians and members of SAMS. It will be basically we will be discussing what has SAMS done in the past few years in Northwest Syria. Are we going to be able to sustain some of the programs that we do have over there? And then we're going to be having our mission. We will be having the president of the foundation and the society give their vision for the next 5 years, 10 years. SAMS did have a vision of having a center of excellence in Northwest Syria before the liberation. We did purchase a big land, and we were thinking that we were going to be building a highly specialized a medical city that does have hospital, does have an educational center. But now our vision, our journey to get to that point is gonna maybe take us on a different route. Especially right now, we look into what's going on inside Syria. We do have some emergency response. We do have fill-in gaps of some urgent issues that the Ministry of Health sometimes comes in and asks us. Then we do have Dr. Amjad Ras, who is the head of SAMS Institute, and he's going to give us a broad vision of our role as SAMS in the education. What are we going to be able to do? How can we contribute? Because our initial assessment showed that education, training, the physicians that are, or like the medical student, the residents inside Syria is significantly lacking. I went and visited the Jamiat Halab, looked at the Mustashfa Halab al-Jami. It is pitiful. The infrastructure is dilapidated. The equipment is so old and run down. So we need a really significant revamp of that whole system. So education is going to be one big part of it. And then we will be having the vision of how can we participate, and it's going to be the arm of medical missions. Our vision of medical missions inside Syria, where everyone is going to be able to go in and help. How is it going to be implemented? Which cities, which universities, how long? All of that will be discussed, and we will be having the input of the 50 leaders in that retreat to give us a vision. Because, as SAMS, yes, as a foundation, yes, we can function, but our biggest asset is right now the 1,000 plus members of SAMS, and we would like to cultivate all of the enthusiasm, the vigor, the the energy of the physicians that comprise SAMS, and we would like to be able to get some vision of where we need to go. So this is what is going to be. And then, that we do have some issues that we will discuss about the financial sustainability. To have all of these programs, to have hospitals, to be able to support educational initiative, training. There will be some center of excellence that will be open, oncology program, CT surgery. How are we going to be able to sustain all of that? So we will be talking with our young leaders to go over that. So these are some of the things that will be discussed, and hopefully we will be able to come up with some resolution, a game plan, and some metrics that we'll be able to look at in the next maybe 6 months, or we'll come back next time we have a retreat and say we're able to achieve 1, 2, 3, and 4.
Dr. Rifai, really thank you so much for all what you have done over the course of your career for the last 10 plus years for the Syrian people, as well as the people who have been kind of jeopardized by the war, and also for your vision and your leadership, leading with your SAMS leadership and foundation and society to be where we are now. Really, we appreciate your time, commitment, hard work.
I'd like to basically reflect on my journey about the medical missions. I will always say, every time I do see my colleagues that have gone on medical missions, I do tell them, that they are the unsung heroes that have left their family behind. They have left their jobs, their kids, and they took a journey all the way from the US and went inside and basically selflessly went, served, listened to the patients, listened to Syrian refugees at that time. And for those are the heroes. And then on top of that, you do have the SAMS staff that has been working tirelessly on the ground to make sure that those medical missions are so successful that we are able to recruit patients, we are able to save patients. So our mission, medical mission, our service as physician would not have been possible without the sacrifice, the dedication of all of SAM's staff on the ground. And for that, I would like to take this opportunity to thank them for all of their work throughout the year. Would like to let them know the journey just started. We probably, each one of us, reached a point where we felt some hopelessness and some despair that maybe it's not going to be in our lifetime that we'll be able to see all of Syria. But God answered the prayers of so many of the mothers and of the people that have been imprisoned. and our journey just started. We need all the effort, we need the dedication, and I am certain that all Syrian physicians will be able to pitch in whatever they can. And I am certain that we will be able to lift the healthcare system. We can only talk about healthcare system. We'll be able to lift the healthcare system of Syria. We deserve better than that. We know we can do it, and we depend on you. And for that, I would like to thank you, Shadi, for giving me the opportunity to talk.
Absolutely. Dr. Rifai, thank you so much again for your hard work and your time again to be with us and to be featured on the SAMS Voices monthly podcast. Watch his videos and podcasts and listen to it on social media, Facebook and LinkedIn and other portals, as well as on the podcast channel. This is Shad Reyes coming to you from SAMS Podcast and Voices in 2025. Dr. Rifai, thank you again for your time and I appreciate
Thank you,
your opportunity to be with us.
Thank you, Shadi. Thank you.
Thank
Have
you.
a good day.